I mean, that's just mind-boggling, right? That the only way insurance companies can make money is to raise that premium. So obviously, as a company, it behooves them to keep raising people's premiums. I mean, what specifically in this entire conversation, because as we've talked about, no plan has passed the Senate. What specifically are you looking out for next?
So I think the Republicans have an opportunity to put a plan on the table to do something differently. All right, like I say, we had our commission meeting, and by the way, I am a MedPAC commissioner, but I want to say I do not speak for the commission. I'm just one of 16 commissioners that weigh in on Medicare payment policy for Congress. And we were just talking on Friday about, what could we do differently? And everybody's talking about nibbling around the edges. This has been where we've been stuck forever. We need a new plan and a bold plan that says we're going to bring down the cost of care $5,000 per capita, which is $1.5 trillion a year. And that is going to be our goal. We have to move towards that goal. And if we don't get there, we might have to control all healthcare costs in this country. That's the way other nations do this, is they have price controls, they have volume controls, they negotiate all the drug prices, right? They don't let technology come into their country that doesn't have benefit and value for the patients, right? We do. And so they won't allow it to be added to the list unless there's demonstration of benefit from either cost, quality, access, some perspective that is meaningful to the consumer. So the government, we've all been not wanting the government to take over healthcare. I say we give the system one last chance to self-police, and if they can do it, great. And if not, then there's a cliff here. We have to take over because we are destroying ourselves with this cost of care. Every American should not have to spend $10,000 a year more than the OECD nations for healthcare at their own expense. And believe me, just because we're not paying that premium, it's all coming out of our taxes, our prices. We are all paying the price for this. And so, yes, let's help people through this time, but let's fix it. This administration has the opportunity to make a bold and different move. And if we cannot succeed, we have to move to a more centralized system in some way, not single payer, but definitely a single governance system that doesn't allow us to play whack-a-mole with the money and doesn't have all the incentives, which 100% of our incentives are in the wrong direction for every single sector of healthcare, including the patients.
Lynn, it's a really important conversation that I don't think is going anywhere. It impacts every American. And as we see, hopefully, positive developments come out of this, I hope you can come back on and break it down for us. You are welcome back anytime. Thank you for joining me.
Thank you so much. And good luck, America.